It's the February 2nd, 2021 episode of Health in 2.0. And the question on everybody's mind is, when Matthew Holt emerges from his hole in the ground, will he see his shadow and crawl back in? Who knows?
Hey, Jessica, did you get invited to the Kentucky Derby? Did you go to the Masters? No? Oh, how disappointing. Well, our friends and chums at Athena Health just got fined $18 million for excessive taking of people to golf, tennis, cricket, horse racing, or whatever. Allegedly, is paying kickbacks for the meaningful use money.
18 million?
Yeah, it doesn't really sound like very much, given that,
I feel like there have been bar tabs by that company that have been big, like Cloud Party, anybody?
Yeah, I think, I mean, I guess we got invited to the Cloud Party, so that was something in Vegas. That probably cost them. Yeah, I mean, I don't know. It sounds to me as though the DOJ went searching for more cheating, the way that eClinical Works and Practice Fusion did it on the test and the exam, and they couldn't find it, and they got grumpy, and they were like, "We're going to come in and look through them. Oh, you took a bunch of people to the Kentucky Derby, and therefore influenced them to buy your product, which they then got paid money for by the government." I mean, yeah, they shouldn't have done it, naughty boys, but that's a real slap on the wrist for a company that size. Anyway,
crazy. Get your timer. There's so much money.
Talking about money, 18 million wouldn't get you on the page today, would it?
Oh my God, 18 million is like not even a big fundraising round anymore these days. It's crazy. No. 187 million. Now that's a funding round, Lyra Health. This is crazy. Third raise in less than a year. Their total now 462 million. How is anybody going to scale in this mental health market, Matthew?
I don't know. I mean, they're the ones who said, Connie Chen, who by the way used to work for me as the medical director there now, said that they had the best therapists, right? So I guess if there's an arms race for therapists, maybe they've got more of them and the other guys have got less, but how much money has gone in and how many therapists are there left who can get allied? We don't know. I mean, maybe they go buy somebody. That's what you were telling me earlier. Maybe they go buy one of their other big competitors like Quartet or Ginger. Hard to imagine some merger. I mean, something's got to happen here because it's a race to the top or to the bottom.
Yeah. All right, SPAC rumors, because now this is a thing we have to cover. 23andMe SPAC rumor, they're valued at $2.5 billion. At least that's the rumor. They just raised $82.5 million in December. What do you think? Going to happen? Not going to happen?
I think they'll come out, but I think they're in trouble because they haven't really got the COVID wave, and the genomics thing is kind of iffy. But it was a good business a while ago.
More SPAC rumors. Roe following Hims in a SPAC. What do you think about that one?
That I think is made up. I think they IPO properly.
Okay. All right. Not a rumor, actually SPAC-ing. I'm going to make that into a verb. Sharecare. They also just acquired Doc.ai. They've raised $425 million. What do you think here?
Yeah, they've been around a long while. Started at Health 2.0 in 2010. So this is an 11-year story. Jeff Arnold, who was the CEO there, and Dawn Whaley on his team and a bunch of others. He was the guy originally behind WebMD, way the hell back when. No one understands what the Browers at Doc.ai do. They've got a big contract with them to do something with artificial intelligence. Who knows what it's about? But I mean, Sharecare's bought about 20 companies, and I think they bought Doc.ai to get to Anthem.
All right. DarioHealth, they raised $30 million. Their diabetes, mental health, and also with their $70 million raise, they just acquired for $31 million an MSK startup called Upright Health.
Yeah, this is a little odd, right? So this is an Israeli company.
It's like, how many more companies are doing? I can't believe we're still doing this. We're building this platform thing.
I mean, this is, but think about it, right? This is a low market cap public company, so traded, less than 200 million market cap. Goes out, raises more money on the private market. Well, I guess it's private market to public equity, whatever they call the pipes thing they call it. Raises some more money to go flesh out a platform. They must be a radio company. They're competing with all the big boys like the Teladoc, Luongo, Amada, et al. One Drops et al. But if you think about it, it's a teeny thing. So they got the pieces together. They must be dressing themselves up, and they're thinking that some of the bigger health plans or medium-sized health plans are going to buy them outright because it's probably going to be cheaper to buy them than to work with Teladoc or something like that. So that must be the play here, I mean, unless they're growing some incredible businesses that we don't know about. Because otherwise, how do you show up at one of these plans or employers and say, okay, we're the number 17 in the market? I don't know how you get in. I mean, because you've got to get past not only Teladoc, Armada, God knows, Virgin Pulse if you're on the wellness side. Then you've got to get past Verta and Vida. And more. And then, when you're the poor HR person, what do? You're the number. You figure it out. So I mean, it must be a dress up for sale to somebody. That's my guess.
All right. Interesting. And there were so many deals we didn't even get to. I mean,
we have to about another 7 shows this week.
I can't even believe all the SPAC-ing that is happening here. That is just nuts to me.
Well, if you hadn't noticed,
if the stock is up, that just SPAC'd last week, or at least it started trading last week. Their deal was announced a while ago.
How do you tell that Hims' stock goes up? Because Jess DeMassa told me to buy it about a week and a half ago. Bloody hell.
Whatever I do and you don't listen to usually works out. It pays dividends, people, real dividends.
Well, no, I mean, look, I
thought you were gonna make like a very dirty ED medicine joke there for a second. My heart skipped a beat. I was like, no, don't do it.
It's early in the morning. I'm feeling slow. Something about
all right, good. Well, let's
going up
here, shall we?
All right.
Let's just leave it here. All right. So for all the dirty jokes that you might have missed on this episode, go and check out Mr. Holt over there on Twitter. He is at BoltyBoy, weighing in with commentary throughout the day and night on all the funding deals that are happening in real time. And to find out what else is going on in this wild world of health tech innovation, go and follow me over at Jess DeMassa on Twitter as well. And to never miss an episode of Health in 2.0, go and sign up for our email newsletter on the healthcare blog. Not only do you get these cute little episodes tucked in there, but also some of the best content from the blog from the week and on WTF Health interviews.
Yeah, including yours with the CEO of Hims, not to mention the CEO of Olive, and who else do you just do?
Hinge, the CEO of Hinge. He doesn't do a lot of interviews. That was a great interview. That was good to hear what they're up to.
All the companies that raised $400 million.
Yeah, now I have a lot to pick from these days.
We better get you on Lyra.
Yeah. All right. Well, see you guys later. Thanks so much for watching. We'll see you next time. Bye.